Swagatam, friends, namaste, hello. So, I am Vivekanand, practicing acupuncture from 40 years. Sound little low. So, Kashyap ji, please check your network. Indrajit ji, is it sound okay? Okay, okay. Thank you, Mira Devi ji. Friends, I am practicing acupuncture from last 40 years. So in acupuncture, I'm practicing many modalities like TCM, like Dr. Tan Balance. In Dr. Tan Balance also, there are the many modalities that is basic to advanced. I am practicing also the scalp acupuncture. I am practicing auricular acupuncture. I am practicing sound therapy. I am practicing quantum physics in the sound therapy. So RTG, I can't talk Hindi because many international students are here. So I can't talk Hindi. Okay. So English, this English, I am talking very easy. So try to understand RTG. So I am also in teaching line. Okay, all modality I am teaching to my students. So there are many students in all state India, in the Canada, in the America, in the uh, Egypt, in the Iran, in the England. Okay, so there are more than 15,000 students. So in my contact, so in my academy, so my academy's name is the Saspandan TCM Academy. So you can find out, you can search the name of the my academy name in the YouTube, Saspandan TCM Academy. So you will get the many free uh, uh, free material, free courses and free materials. You can get that on the YouTube. Also, I have on the Android app. So that app also working on the iPhone in the India. So some out of India, some countries that app is not working, like Canada. Okay, this app is not working. Okay, but Dubai, Abu Dhabi. Okay, so that my app is working. So you can get the link of my app in my group. So all are requested. Again, I'm putting the group link in the chat box. So you can join the group with that link. So this link is coming. You can see those who yet not join my WhatsApp group, they only join. So those who are already in my group, so they don't join. Okay. So let us start our session. Friends, in our acupuncture, in TCM acupuncture, there are master point. There are the master point. So that they are that master points are the 60 master point. That is the command point. 60 command points. So in uh, other meaning, the in other way, we are saying that are the five shoe transporting point. That is the five shoe transport. They are related to the five elements. So we are talking that there is a five shoe transporting point. So let us start to discuss that the five shoe transporting points, that is the shoe points. It start from the tip of the four limbs. So on the two hand and the two leg. Okay. So and continue they are the starting from the forelimb. So the tip of the forelimb. Okay, from tip of the forelimb. Tip means the fingers and toes, and continue all the way the elbow and the knee. Okay, so that all points 60 common point, that the 60 transporting point below the elbow and below the knee. Please understand. Their all points are the below elbow and below knee. So I am going to share you the PPT so you can understand in more detail. Okay, this is our five shoe transporting point. Five shoe points. So five shoe transporting point. So what are the points name or in the Chinese name? Okay, so the points are five types of point, five categories. So one is the Jingwell point, then Ingspring point, there is the Shoestring point, there is a Jing River point, and the Hesse point. Okay, there are the five categories of the point. Jingwell, Ingspring, Shoestring, Jing River, and Hesse. So you have to understand well. You remember that there is the five show transport. There are the 60 common point. All 60 common point have the five categories. So that categories is the five: Jingwell, Inspring, Shoestring, Jing River, and Hesse. So five shoe transporting point, that is the Ushuxi. Ushuxi, yeah, this is the Chinese character. Ushuxi. So these are special acupuncture point on the 12 meridian. These points are the special. So all points are very important. All points on the body are very important. But these points are very special. This 60 command point, this 60 transporting point are the very important. These are special acupuncture point on the 12 meridian where chi flow from the fingers and toes. Chi flow from where either it is flowing from the fingers and either it is flowing for the toes and toward the elbow and toward the knee. Okay, so I previously told you that all points are below elbow and below knee. So each point have the specific function and belonging to the one of the five categories. So which are the five categories? Jingwell, Inspring, Shoestring, Jing River, and Hesse. So some some part of the any countries they are telling that khasi point, khasi. So in India we are telling that hasi point. Okay, so jingle point. So see and khasi. So jingle points are located on the fingers and tip of the fingers and the tip of the toe. It is the starting. Nature of the point is the starting. And the main action point of the jingle point, the main action is the clear heat and the open the orifice. Okay, what is the main function of the jingle point? So jingle point, clear heat and open the orifice. Then secondly, it is the in-spring point. In-spring point. So after jingle, okay. So location is the next to the finger and toe. So where the fingers is attaching here, okay, on the web margin, web margin, okay, web margin of the finger and web margin of the toes, okay. So next to fingers and toes, okay, that nature is the small stream. It is like it is a stream that water flowing like stream, okay. So it is a small stream. So that indication that in spring point's main indication is the clear heat and the treat febrile disease. If there is the heat in the body, if there is a febrile condition in the body, so that condition treated by the in spring point. Our third point, third category is the shoestring. And a shoestring on the wrist or ankle. Okay, so wrist and ankle, shoestring point, wrist and ankle. Okay, so in Indian culture, okay, our ladies, okay, have to wear the bangles and the ankle in the wrist and in the wrist and wear the anklet, that paisan. We are the so in Indian language, in Marathi language, that is the paisan. That is the silver anklet where our ladies, our sister are wearing the anklet uh, in the uh, uh, in the ankle and wearing the bangle in the wrist because that shoestring point are the source point, Johnson's point, because Johnson's point carry the kidney's energy. Okay, so by Bengal and the anklet, that points are getting stimulated, and that and what is the shoestring point character? Shoestring point balance the entire meridian. Very important indication of the shoestring point. Shoestring point balance the entire meridian. Okay, so if some ladies wearing the anklet and wearing the bangles, she don't have any disease problem. You can observe. Okay, so shoestring point, the nature is the that is the stronger nature, and main action is the dampness. Yeah, okay, that points remove the dampness. That point treat. Okay, that point manage the joint pain, and that point manage the heaviness because when there is the dampness, heaviness comes. Okay, so heaviness also flame. When there is a dampness, then dampness turn into the flame. That is a visible flame and invisible flame. Okay, so then next, our next category of the transporting point, it is the Jingwell point. Okay, sorry, Jing River point. Jing River point. So that point is on the forearm or the leg. For location of that point is the forearm and leg. So this point is the river flow. This point, at this point, our energy, our chi like the river flow. Okay, and Jing River point always treat the cough. Okay, always treat the asthma, and it is used for the voice disorder. Okay, when lung chi is deficient, so voice come very weakly. Okay, weeping. So slowly. Then last our Hesi point. Hesi, that is the Khasi point. Okay, so that location is on our elbow or the knee, elbow on the knee location. Okay, and this is, and at this point, the energy like the sea, energy like the ocean. Okay, and this main indication, main action is the digestive disorder and chronic disorder, digestive and the chronic disorder. When uh, energy, when any energy in the at any meridian, when it is going contraindicated, okay, okay. So when energy is going rebellious chi, so this point manage that energy. There also Hesi point. So Hesi, that is the sea of energy. Okay. So when whatever which disease you find, okay, you always use the shoestring point. The shoestring point balance full meridian, and Hesi is the sea of energy. Hesi point is the sea of chi. Understood? So this is the table that is a lung meridian. In meridian have the wood, fire, earth, metal, and water. So Jingwell, in spring, shoe stream, Jing river, and Hesi. So at in point, in meridian have the this sequence. It start from the wood, fire, earth, metal, and water. That category sequence is same: Jing Wailing, Spring, Shoestem, Jing River, and Hesi. And in case of young meridian, that points, that elements start with the metal. Okay, so Jingwell point is the metal, then in spring point is the water. Okay, in case of young meridian. Okay, then the shoestring point is the wood. Then Jing River point is the fire and the Hesi point is the earth in case of young meridian. Okay, you have to understand this difference. Okay, whether when that energy start from the old energy is the wind, heat, humidity, dryness, and coldness in case of in meridian. And in case of young meridian, that is the dryness, coldness, then wind, then the heat, and then the humidity. Okay, so we start from the Jingwell point. So Jingwell points, it is the ting point. So Jingwell is the ting point. So Jingwell points is always located of the tip of the fingers and the tip of the toes. Okay, so first point of the in meridians. Okay, let us start the discussion of the on the in meridian, and or the last point is on the yang meridian. Okay, so nature of the uh, jingle point. Nature of the jingle point. What is the nature? That is chi start there at jingle point. Jingle point, chi start there. So like a small spring. Okay, spring. That is the it is in the whale. Okay, that is the spring is getting in the whale. We are excreting the whale. So we are getting water there. That is the small spring. So that is like the Jingwell. Okay. So like a small spring. So what are the function of the Jingwell point? So Jingwell points clear the heat quickly. When we prick the bring Jingwell point in cause to bleed, it's clear heat quickly. Open the orifice, that is the brain consciousness. Okay, brain consciousness. Or when someone is suffering with the fainting, okay, we are pricking this jingle point, so it's open the very orifice, brain consciousness. It is good for the reviving of the fainting. Okay, so we can rescue any person so who is suffering the fainting. So, and jingle point treat the fullness. Jingle point treat the fullness below the heart. That is the chest tightness. That is the agitation. And this jingle point good for the mental and emotional disorder. So so we are discussing the jingle point. So now number second, it is the in spring point. In spring point. So in spring point, it is the in point. So in second word, in other word, it is the in point, in spring point. So location of the in spring point, it is the just above the jingle point. It is the uh, point 0.5 from the wave margin of the finger of or toes, point 0.5 June. Okay, so just above the jingle point, and then near the fingers and toes. So what is the nature of the in-spring point? So chi is like a small stream. Okay, so in the in case of the in-spring point, so chi nature of the in-spring point, the chi is like a small stream, and function of the in spring point is the clear heat from the body. Okay, in spring point clear because the in spring point is the fire point in the in meridian. So they when we are sedating the in spring point, so it's clear the heat from the body, and it is the good for the febrile disease in case of fever. In spring point, treat fire and inflammation and calm the mind. Okay. Then third, our in case of in meridian, it is the earth point. Our third category is it is the shoestring point. Shoestring point. It is the earth element is the earth. That are the shoe point. So location for around the wrist and the ankle. Okay. Shoestring point location is around the wrist and the ankle. And the nature of the shoestring point is chi becomes stronger and deeper. Okay. At the shoestring point, chi flow. Okay, and and at when chi comes to the shoestring point, chi becomes stronger and deeper. It's deeper. Okay, it is not superficial. It is deeper and it is stronger. So I told you this, that shoestring point balance the entire meridian when you prick the shoestring point. So that shoestring point is the middle. There are the five points. Okay, the shoestring point is the middle one. Before shoestring, it is a in-spring, it is a jingway, and after shoestring, it is a jing river and the khasi point. Okay, so shoestring point is the middle point. So that shoestring balancing the entire meridian. Please understand. Okay, so function of the shoestring point. What is the function of the shoestring point? So shoestring point treat joint pain. It's we can manage any joint pain by applying the shoestring point. Shoestring point treat heaviness, because in meridian shoestring point in the earth have the belonging to the earth meridian, that is belonging to the spleen and spleen meridian. It is the earth meridian. So earth meridian, where there is if there is a earth deficiency, earth and spleen deficiency, there will be heaviness, there will be dampness, okay? There will be flame. So because of that deficiency, flame and dampness occur, and there will be heaviness in the body. So we can manage that heaviness with the system point. These points are important for the arthritis. We can manage arthritis with the shoestring point. Okay, shoestring points treat deafness conditions, and they use for the Johnson's point. So shoestring point is the Johnson's point. So we are receiving the Ming Yang energy. Okay, Ming Yang energy through the shoestring point. Okay, who carry the Ming Yang energy to the shoestring point? Do you know? Our triple warmer meridian carry the kidney Ming Yang energy to the shoestring point. Okay, so triple hormone meridian. So when what is the organ clock time of the triple hormone meridian? Triple hormone meridian organ clock time is the 9 to 11. So if you are in deep sleep in the 9 to 11 p.m. Okay, then sleep triple warmer maiden will be happy, and it it transport the Ming Yang energy to the all shoestring point. It is a okay. So it's because of that it treat every disease. It treat every problem. Because of that, treat it balance full entire meridian. Okay, this point shoestring point used for the Johnson's point on the in meridian. Shoestring point, Johnson's point for the in meridian. Earth point. Then number 4. At number 4, it is on the our as per this chart. Okay, this chart in front of you. Number 4 is the metal element. Okay, so category of the Paisho transporting point category is the Jing River point. Jing River point. So location of this point near the forearm and the lower leg. Location of the forearm Jing River point near the forearm and the lower leg. And the nature of the this point is the Chi flow like river. It is like Ganga, Jamuna, okay, Godavari, Tapi. That this is the Indian. These are the Indian river. Okay, so in big river, this chi like a chi flow like the big river, like river. Okay, so function of the Jing river points are they treat cough, asthma, sore throat. Okay, sore throat. Jingwell point treat cough, asthma, sore throat, and good for the voice disorder. These points are good for the voice disorder and clear heat from the lung and treat tendons and bone pain. Okay, so if there is a hardness of the tendons, hardness of the bone, why it is a hardness? It is the dryness. The dryness, the energy of the dryness is related to the lung. Okay, so Jingwell point can manage the tendon and the bone pain. Our last category is the hissy, khasi. Khasi. It is the sea of energy. It is the ocean of energy. Khasi point. It is the ocean of energy. The location is the near the elbow and near the knee. And nature of this energy, nature of this point is that at this point, chi collect like a big sea. So chi gather like the big ocean. This is the ocean of chi. These Hasi points are the ocean of chi. And the function of the Hasi point is to treat the digestive disorder. Okay, they treat digestive disorder. Okay, treat stomach and intestinal disorder, and they are good for the counter flow of energy chi. In the counter flow of chi, that is counter. What is the counter flow of chi? When the stomach also is going up to down. Okay, its flow is toward the down. When there is the deficiency of the stomach, or stomach start to flow rebellious, counter flow. Okay, so because of that counter flow, it will be vomiting, it will be diarrhea for the spleen. If spleen is going rebellious, there will be diarrhea. If the stomach going rebellious, it is the vomiting, it is the belching, it is the nausea. Okay, so this Hasi point. So when we apply the Hasi point, when we apply the Khasi point, so that rebellious chi will be reversed. Okay, so and it also clear the damp heat because that points are the homeostatic point. So Hasi points always, mainly Hasi point are the homeostatic point, like the Li11 is the homeostatic point. Okay, homeostatic point. So whatever heat is there, whatever cold is there, so it bring in balance condition. Okay, so it is a homeostatic point. So used for the chronic disease. Hasi point, Khasi point we can use for the chronic disease. So now we are discussing now Jingwell point. So in Jingwell point and Yang Jingwell point. Okay. Now we are going to in Jingwell point and the Yang Jingwell point on the lower extremities. So this is the liver one jewel point. So I am showing you the liver one question about the liver one. Okay. So आरती समझ रहा है ना आपको? आरती जी समझ रहा है आपको? ओके ओके. So this is the liver one point. Okay, liver one point. Okay, this is the lateral corner of the nail of the thumb, big toe. Sorry, nail of the big toe. Okay, location on the lateral aspect of the big toe, point one chun proximal and lateral to the corner of the nail. Okay, this is the lung one point. Okay, so how we can so this is enough. Okay, not need to show the video. Okay, liver one point. It is the jingle point. So it is the foot joint liver. Chinese name of the liver. It is the foot joint. Okay, so it is the Chinese name, and the liver one point is the Dadun in the Chinese. Okay, you can you should familiar with the Chinese name of the meridian and the Chinese name on the of the point. It is not necessary, but here this name category of the jingle point of the liver channel. It is the wood point on the wood meridian. Okay, so it is the horary point. So same same point, wood point on the wood meridian. So it is the horary point of the liver meridian. So location on the lateral corner of the big toe. It is a point one chun from the corner of the nail. Function of the liver one. So this is the jingle point. So liver one clear the liver fire. Okay, this point clear the liver fire and liver heat. Like red, when there is a red eye, there will be irritability, there will be anger, there will be headache, there will be bitter taste. It is in case of the liver young rising, liver heat. Okay, there will be bitter taste and dizziness. Dizziness is there and high liver young rising. Okay, we treat this point. Okay, you are going to bleed this point. Liver young rising. Okay, so liver one also regulate the liver chi and it descend the rebellious chi. When liver always hyperactive, liver never deficient. Liver never deficient. There will be only two two character of the liver is in the deficient, liver insufficiency and the liver blood deficiency. So otherwise, liver always hyperactive, liver always excessive. So when liver is excessive, it will be horizontal rebellious. So liver control the spleen, over control the spleen and over control the stomach. So this point regulate liver chi and descends the rebellious chi when liver is hyperactive. Okay, he stop his control the liver to get rebellious. So this point is useful in the hernia pain. When there is a hernia pain, in some when patient comes to you with the hernia pain, okay, apply this point. And lower abdomen pain, also hypochondriac pain, and sudden genital pain. If there is the genital pain, okay, you use this point because at liver meridian take the round around the genital. So this point is working for the sudden genital pain. Liver one also stop bleeding. How this is a very important lingual function. So liver one stop bleeding, very important lingual function. So using the uterine bleeding, when there is a uterine bleeding in the ladies, there will be nosebleed. That is the epistaxis. Okay, nosebleed. There is the hemorrhage due to liver heat. There is the piles. That is the hemorrhage due to liver heat. Okay, so prick the needle, prick the liver one, and cause to 20 drop of blood. Okay, this problem will be managed. So, liver one resuscitation point because it useful for the loss of consciousness. Liver one because okay, liver one is useful for the loss of consciousness, shock, and collapse. And also liver one calm the shame. Okay, it calm the shame. Liver one calm the shame because liver affect the hun. Hun is the liver spiritual energy. That is the ethereal soul. Hun is the ethereal soul. Okay, liver liver affect when liver is hyperactive. Okay, liver yang rising. There is a liver fire. It affects the hun. It affects the ethereal soul. So liver one can calm that. So also liver one working on the irritability, insomnia due to liver heat. When there is a liver heat, so there the symptoms. One of the symptoms there is the insomnia. Then indications. What are the indications as per TCM? So liver fire, liver stagnation turning into the heat. When prolonged liver stagnation is turned to the heat, apply liver one. Hernia, shunt disorder, uterine bleeding due to heat, and the fullness below heart. Heart means chest tightness, and the headache, okay? So dizziness, irregular menstruation from the heat, hypochondriac pain, urinary retention from the liver. Okay, our next point, we are going to next point. It is the foot in jingle point, spleen one. Let us go for the spleen one. This is the spleen one. So same opposite of the liver one. So liver one is on the lateral corner of the nail of the big toe. This is the medial corner of the nail of the big toe. Spleen one. So spleen 1, it is the foot in lingual point of the spleen channel. Okay, so category of the this point is the jewel point, wood point of the spleen. Okay, wood point of the spleen channel. This is the ghost point. Ghost point. So ghost means not actually ghost. So don't scare. It is not a ghost. It is a ghost means black thoughts. Ghost is the it is the black thoughts. It is the negative thoughts. Okay, when spleen. So uh, about the spleen, I'm telling you a story. Okay, spleen as per the uh, in energy. Okay, uh, energy of the spleen. Okay, spleen control thoughts when spleen is normal, when spleen is straightened. Okay, so spleen control thought. When spleen is deficient, there will be excessive thought. If spleen is deficient, there will be brain cloudiness, brain cloudiness. Then patient will be speak unmeaningly. Okay, uh, a patient can be hallucination. He can suffer with the hallucination. Okay, he can see someone stand behind me, someone stand opposite me, someone pressing my chest. Okay, so patient behaving like he is looking some ghost. Okay, so spleen 1 is the ghost point. Okay, when we are bleeding that spleen 1, okay, that patient suffering will be managed. This is the entry point of the spleen meridian. Okay, entry point of the spleen meridian. Every meridian have the entry and exit point. And this spleen 1 is the entry point of the spleen meridian. And location of this point is the, I told you, on the medial side, uh, inside. Okay, yeah, medial side, inside, inner side of the big toe. That is the point 1 chun posterior to the corner of the nail. And function of this point, this TCM function, this point stop bleeding, especially uterine bleeding, and stool bleeding, where when there is the hemorrhage, and when there is the piles bleeding. Okay, so bleed this point. When there is the omitting blood, so omitting blood, use this point. Okay, when there is the bleeding, so you can use the any type of bleeding, where is the heavy menstruation, where it is the uterine bleeding, it is the stool bleeding, it is the omitting of the blood. Apply spleen 1 and liver 1. Prick both bilaterally. Okay, and take the 10 to 15 drop blood on each point bilaterally. That bleeding will be stopped immediately. And after that, you can treat that patient according to the pattern. There may be spleen Qi deficiency, spleen Yang deficiency, spleen Qi sinking. Okay, so and, that character you can find by looking his tongue. So this point, spleen 1 point, stop bleeding, especially uterine and stool or omitting blood. It's regulate the spleen and stabilize the mind chain, because when uh, spleen is getting strengthened. Okay, so black thoughts and that excess thought will be controlled and mind will be get calm. This point restore the consciousness and this point clear the heat from the spleen channel, spleen one. This is about the spleen point. And what is the indication? This is the uterine bleeding, heavy period, of blood in the stool, and epistaxis, it is a nosebleed, and coma, it is loss of consciousness and the mental restlessness, insomnia, swelling of the big toes. And you can needle point 1 to point 8 to bleed. Now, let us discuss the point kidney 1. See, this is the kidney 1 point on the soul. Okay, this is the Jingual point, sedation point, this is the wood point of the kidney and kidney channel. It is the entry point of the kidney. Its location in the sole of the foot on the line dorsum posteriorly between the second and the third toe in the depression formed between the anterior one third and the posterior two third parts of the sole when the toes are plantar flex. When you stroke plantar flex, okay, then you get the depression on the sole. Okay, so kidney 1, it is the foot showing. Kidney is the foot showing. That is the kidney channel, and this is the Jingual point and location I told you. And this point category is the Jingual point of the kidney channel, wood point, and entry point of the kidney meridian. And function of this point as per TCM, it's subdue, it's reduce the liver yang rising. Okay, so we are increasing the in. Okay, this is the where C of in. This point is the C of in, and kidney 6 also point out is the C of Eve. Okay, so it subdue the liver yang rising and the clear heat and empty heat. This point calm the shame and rescue yang collapse. This point tonify the kidney in and the kidney chi. This point restore the consciousness for the fainting. When someone faint, when you are needling the patient, okay? So when there will be giddiness, when there will be fainting uh, on your treatment table, okay? Patient getting faint, okay? So you first apply the DU26. So if again fainting is there, so go to his soul and strongly press on the kidney 1. Immediately the fainting will be restored, and the consciousness will be restored. So indication of this point is the when there is the vertex headaches. Vertex headaches. Okay, apply this point. When there is a dizziness, when there is the hypertension, when there is the anxiety, when there is a palpitation, when there is the fear, kidneys emotion is the fear. When there is the insomnia because yang, excess yang, okay? So kidney 1 control the excess yang. Loss of consciousness, kidney 1. Sore throat, if there is the kidney indeficiency, in case of kidney indeficiency, there if there is the sore sore throats, kidney one. So hot flashes in case of menopause condition in the ladies, hot flashes. Apply the kidney one. Night sweat. If there is a night sweating, apply kidney one. Foot swelling and numbness of the feet and excess heat moving upward, epilepsy and agitation. So in case of the epilepsy, okay, that cause excess heat moving upward. Okay, so how you can needle the kidney one? So perpendicular 0.3 to point maximum up to. So avoid deep needling. Don't needle more than up to. And you can give the useful for the moxa is useful for young polyps. When there is a young polyps, give the moxa to the kidney one. And shock, in case of shock, in case of fatigue, in case of chronic kidney deficiency, in case of CKD, in case of CKD problem. Okay, so you can give the moxa to the patient. Now let us discuss about the bladder 67. Okay, why I check that? Bladder 67. Urinary bladder 67. This is also the this is the biggest meridian in our body, bladder 67. So we have the bladder, very important point, bladder 67. Okay, so this is the Jingwell point, tonification point, and the metal point. Okay, so this is the young meridian. So first point is the metal. In case of in meridian, first Jingwell point is on the uh, wood, wood category. Okay, this is the metal category. Okay, metal point of the bladder channel. This is the exit point. Okay, so after this point, chi enter into the kidney meridian. Okay, so location point one chun proximal to the lateral end of the proximal border of the little toe. Little. So see this little toe. Okay, you can this is the you can see this the point UB 67. So bladder 67. So foot tayang. Bladder Chinese name is the foot tayang. This is the Jingwell point and location. I discussed this location of bladder 67. So point category is the Jingwell point of the bladder channel, and this is the metal point, and this is the tonification. And function of this point is this point expel wind. This point clear head and the eyes. Bladder meridian start from the UB1, bladder 1. Okay, it's called start from the inner canthus of the eyes. Okay, and it's traveled to the whole head. Okay, so clear the head and the eyes and turn the fetus in the beach presentation. Okay, so in the way there is a uh, opposite cross condition, the fetus is the in the cross condition in the womb, when we find in the sonography in the 7th month only. We can treat that condition on the 7th month, okay, in pregnancy. So this point uh, turn the fetus in the beach presentation. This point facilitate the labor if in end of the pregnancy when labor is not happening. So, okay, give moxa to the bladder 67. Okay, so this point facilitate the labor, benefits the nose because of sinus and the congestion. Okay, it's a known nose congestion is there. So this point give benefits. Clinical use of this point is the headache. Okay, especially vertex and occipital headache. Eye pain at the inner side eye pain. So blur vision, nasal obstruction, and the sinusitis, and difficulty in the labor. Okay, breech baby correction. So moxibustion at the UP67 when the breech baby. So give moxa on the bladder 67 only in the month of 7 in the pregnancy. Okay, so pain along the bladder, also is treat the pain along the bladder channel. So how you uh, uh, use this point, how you to use point in this technique. So needle zero point 0.1 to zero point 0.2 tune, zero point 0.1 to 0.2 tune, perpendicular or obliquely. Okay, so moxa is very common use, especially for the breech baby. Okay, when you find in the histography, so every pregnant woman should always do the sonography to see the condition of the baby. When you if you find the condition of the baby, that breech condition, okay, give moxa to bladder 67. That baby will be turned into normal condition. So I done many cases like this. Our next point, our next young meridian point, it is the stomach 45. Stomach 45. We are discussing the jingual point. So we are coming to the stomach meridian, and jingual point of the stomach meridian is the stomach 45. End of the stomach point. Stomach have the 45 points. Okay, stomach 45. See this point. Okay, this point is the jingual uh, point is the sedation and the metal point of the stomach channel. So location on the second toe. Okay, zero point 0.1 tune. This point on the second toe. 0.1 tune from the lateral corner of the nail. Okay, this stomach 45. So see this point. Okay, I'm going to enlarge. Going to take zoom. Okay, you can uh, properly see this point HT44 on the second toe. That is a lateral corner of the nail of the second toe. Okay, HT45. So HT45, it is the stomach meridian. Stomach meridian, Chinese name of the stomach meridian is the Foot Yang Mi. Foot Yang Mi, that is the jingual point stomach. It is category of the this stomach 45. This is the jingual point of the stomach meridian. This is the metal point. This is the sedation point, and this is the host point of the Sun Si Miao. Sun Si Miao. Okay, ghost point. Okay, so On the this location on the second toe, point one chun lateral to the corner of the nail of the second toe. Function of the this point, stomach 45. So clear heat from the stomach channel and restore consciousness and calm the spirit. This point calm the spirit. That is the shape of this point because stomach meridian is the traveling U shape on the face. Okay, so this point remove the heat, clear the heat from the face, that eye, nose, and mouth. So what are the main indication for the stomach 45? So it is based on the TCM. So you can treat the toothache, because stomach meridian is flowing through the teeth, okay, especially the upper teeth. When the toothache happening on the upper teeth. Stomach 45 manage also epitaxis, okay? So as ST43, ST3, ST2, okay? So this is near nose, okay? So it manage the epitaxis, nose bleed. So it caused the sore throat ST9, okay? ST9. So facial paralysis because stomach take U-shape round on the face and dream disturb sleep. Stomach 45 manage the dream disturb sleep. Mania, agitation, anxiety, heat in the stomach channel and loss of consciousness. Fainting, that is the acute condition. When fainting as an acute condition, okay, use stomach 45. Cold in the limb due to channel disorder. When there is the limb, when the hand and the feet are the cold, because if there is the earth deficiency, clean and stomach deficiency, there will be always coldness in the hand and the feet. So how to needle this point? So point 1 to point 2 chun, perpendicular or obliquely. So can prick to bleed as the Jinguel technique. Okay, you can take the blood from the this point to reduce the heat, stomach heat. Okay, when there is the stomach indeficiency, bleed this point, stomach cutting. Okay, so Jinguel point action summary. So you can summarize the Jingwell point action. So Jingwell point treat the fullness below the heart, acute condition, mental emotional disturbance, restoring the consciousness and the clearing the heat. Okay, so stomach 45 does this specially for the stomach Jiangming channel. Now our last Jingwell Yang point is a gallbladder 44. GB44. Okay, last point of the gallbladder. Gallbladder have the total point 44 point. Okay, GB44. Okay, this is the Jingwell point of the Yang meridian, gallbladder meridian. Okay, gallbladder 44. Okay, this is the Jingwell point and metal point of the gallbladder channel. Location of this point is the on the fourth and fourth toe, and second last two. It is the one chun from the lateral corner of the nail. One chun from the lateral corner of the nail. Okay, this is the, you can see stomach 44. Okay, one chun lateral from the from the nail of the fourth toe. This is the fourth toe. Okay, so GB44, Chingwell point of the foot Shaoyang. Foot Shaoyang, gallbladder meridian. Chinese name is the foot Shaoyang. So you have to remember the all 12 meridian Chinese name. Okay, so I hope all of you you know this Chinese name. So this is the gallbladder channel. Okay, Port Shaoyang. Chinese name of this point GB44. The Zhu Chiao In. Zhu Chiao In. This is the gallbladder. When suppose any Chinese, I have the many Chinese doctor. Okay, so if I keep lecture, so they will talk like this in Chinese word. Okay, so you have to try to remember this name. Ji Chiao In. Okay, it is the GB44. So category of this point is the Jingwell point of the gallbladder channel. Jingwell point of the gallbladder channel. Okay, all are requested. Please join my WhatsApp group. So I am sending this link on the chat box. Okay, you can find the link in the chat box and you can join the group. So many notification you can receive by my free course on by my course uh, uh, paid course. So I am going a main very important course on the meridian conversion and the meridian circuit. So okay, so we can manage we can manage any disease with the convert the meridian, and we can know the circuit of the meridian in the disease condition, how disease that is the chronology, how the disease travel through the that six patterns with Tai Yang, Tai Yin, Shao Yang, Shao Yin, or Yang Ming and Juin. Juin is the terminal pattern. Okay, when this is reached to the terminal pattern, it is very difficult to manage. Okay, so we can know how this is travel. So so what is the latest condition of the patient on the which energy, which meridian disease is there. So uh, you will get that link in my group, so you can aware, you can get the notification of my every course, whether it is free or whether it is paid, you can get the notification. So we are discussing the GB44. So uh, we discuss the Chinese name of the GB44, Zhu Chiao Yin. So category is the that Jingwell point of the gallbladder meridian. It is the metal point. Okay. So one of the five shoot transporting point of the gallbladder meridian. So location we discussed. So function of that point as per TCM. So this point clear heat and the fire from the gallbladder channel. Okay. This point clear the heat and the fire from the gallbladder channel and benefit to the eye because this gallbladder channel start from the outer canthus of the eye. Okay, outer canthus of the eye. So this point is the benefit the eyes and the ear because gallbladder meridian the GB2, GB3, it comes to the ear and take round to the your GB8, okay, on the upper side. Okay. And zigzag, zigzag round. It's take the zigzag round on the head. So it is the benefit for the eye, ear, and the temporal region. Okay, this point calm the mind and that is calm the shame. It's subdue liver yang. Okay, this point is GB44. This point is the can subdue, okay, reduce the liver yang rising, and it's clear the gallbladder damp heat. This point clear the gallbladder damped and indication of the gallbladder 44 is used for the migraine, especially temporal or lateral head pain. So beat this point, maximum 30 is a redness of the eyes. That when there is a pain, there is the inflammation. Okay, so there is the ear pain. There is the tinnitus, ringing in the ear, tinnitus. Okay, so prick this point to cause to bleed. So this tinnitus, if tinnitus due to gallbladder heat, if there is a gallbladder heat, you can see the tongue. Okay, so you can see the pattern of the gallbladder heat through the tongue. So then, if tinnitus is there and gallbladder heat is there, then prick this point, cause to bleed, then tinnitus will be stopped immediately. Okay, so hypochondric pain is treat the hypochondric pain. It treat the irritability in the patient. So patient could not able to sleep, insomnia from the liver fire when there is a liver fire. Okay, so it's agitating to the mind. It is agitating to the shame. So there is will be the insomnia and disturb sleep that there will be nightmare and febrile disease. Okay, you can use this point in case of febrile disease or pain or swelling of the toes of the foot. Okay, so nature of the jingle, the jingle point treat the fullness below the heart, clearing the heat, restoring the consciousness, expelling the pathogenic factor. Always remember when there is the attack of the pathogenic factors, wind, heat, humidity, dryness, and coldness, that is the excess that the pathogenic factor. Okay, so use first apply the jingle point. So gallbladder 44 is excellent. Remember, write down. Gallbladder 44 is excellent when symptoms are acute. Symptoms are sharp and symptoms are fiery. Again repeating, gallbladder 44 is excellent when symptoms are acute, symptoms are sharp. There is the sharp pain in the head, if there is a fiery symptoms. use the gallbladder 44 and how to use the gallbladder technique. Okay, needling technique is the perpendicular or the oblique point 1 to point 2 tune. Okay, so if you are giving the acupressure, the gentle pressure for the 30 to 60 second, 1 minute pressure. Okay, so all of you are requested again, uh, join my WhatsApp group with this link. Again, I am sending the link on the chat box. Okay, when you are, if you are already on my WhatsApp group, you don't join. If you are not on my WhatsApp group, please join the link. And okay, so I'm going to discuss. I'm going to unmute yourself. I am going to allow you unmute yourself. You can ask your queries. I'm open for the queries. You can unmute yourself and you can ask.
Namaste, sir.
Namaste, Miraji.
Sir, is it compulsory to needle or just we can put the magnet also in jingle point?
So magnet, madam, a jingle point. It is a very superficial. So
Yeah.
you can apply the star magnet.
Yeah. That's all.
You can apply the star magnet because star magnet is always pricking, no?
Yeah.
Star, you can apply the star magnet.
Bleeding also you can do it, no?
Needle. If there is an acute emergency, acute fainting, acute headache, acute pain, okay? So you needle prick that point, cause to blood,
Okay. How many
okay?
drops of blood we can?
10 to 15 drop, 20 drop.
Okay.
Huh.
If you prick the liver point, no, sir, LI1, liver 1 point.
If there is the bleeding, there is the bleeding, it is the uterine bleeding, it is the heavy menstruation, okay, a lot of menstruations. Sometimes many ladies are getting this, that menstruation is not stopping. The full month they are suffering with the menstruation. So in case of that condition, use the liver one and spleen one.
Okay.
Prick that point, cause to bleed.
Okay, sir. Thank you, sir.
And identify the, you have to learn the, if you are not familiar with how to diagnosis, okay, you have to learn to how to diagnose, how to identify the pattern differentiation,
Okay.
okay. So by tongue diagnosis with the symptom, how patients talk, how patient walk, what is he like, what is he dislike,
Okay.
what is the taste of the patient, which so uh, that is the uh, diagnosis art. You
Okay.
have to learn this diagnosis art.
Okay. Thank you, sir.
Okay. नेक्स्ट, हाँ हरि बाबू बोलिए। हरि बाबू।
Sir, namaste, sir.
हाँ
Sir,
नमस्ते
namaste,
बोलिए।
sir. I am Haribabu from Bangalore.
या
Sir, I interested to join your paid classes. When you start, sir, paid classes?
which class do you want to learn?
Acupuncture, sir. Acupuncture.
Acupuncture. Now my listen, Hari Babu. If you are practicing acupuncture, you need to learn the pain management first.
Okay.
With for acupuncture, in acupuncture clinic, most of people coming for their pain. for their knee pain, for their lumbar pain, their shoulder pain.
Yeah,
You
yeah, yeah.
learn, you first learn about the pain.
Okay, sir.
Okay. So my pain management course is ready. So you WhatsApp me, and separately when this session end, you WhatsApp me. So I will discuss with you how to learn
Okay,
and how to purchase that course. Okay.
okay. Thank you, sir. Thank you so
Okay.
much.
Okay. 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 Okay.
Sir, good evening, sir.
Good evening, Miraji.
Now, we have been talking a lot about stopping bleeding, excessive bleeding, all these things. Now, does this also apply to this thing, menopause? Because many
Yeah,
women,
ha, ha, ha. It can be menopause means it's a lot of heat symptoms. Menopause is the heat symptom.
huh,
Okay, so for heat syndrome, that the inspring points are working.
which
You
one,
have
sir?
to stimulate the inspring point.
Huh,
Inspring point.
yes, sir.
Inspring point means in channel inspring point. The like spleen to the like heart ache, like pericardium ache.
Hmm,
Okay, like L10,
huh,
huh? Then liver to, okay,
huh.
kidney to, spleen to,
Yin channels.
in channel, in channel.
Because most of them have excessive bleeding with extreme, with big clots or small clots,
Yeah,
and
yeah.
hot flushes and tiredness, basically,
Yeah, pleasure, tiredness. It is
and
because of
mood swing.
tiredness is the spleen symptoms.
Yes,
Spleen
sir.
G deficiency, spleen yang deficiency is there.
Because lot of
Miraji,
women come for this.
Miraji, you have to learn the pattern differentiation.
Huh.
So how to diagnosis?
Yes, sir.
Yeah, yeah.
Thank you, sir.
Welcome, welcome, welcome. Next, enough. No any queries. All are brilliant, I think.
Sir, Muhammad Bashir. Can I use
Mohammed.
use in GB44, right? Anna,
हाँ
how can you use needle?
GB44. Yeah, in case of Jingwell point, so don't prick deeply or prick the needle on the
Okay,
GB40
sir. Okay.
for point 1 chun. Point 1 chun, 1 mm or 2 mm horizontally, not deeply. Because at the tip of the finger, that point is very painful. Okay?
Okay, sir.
हाँ.
Good evening, sir.
हाँ उमा जी.
Sir, this the pricking thing, the bloodletting, we have to do just once.
We can bloodletting session do by weekly once.
Weekly
If
once, okay.
once in the week.
And the rest of the day, we can just give a needle over there.
Needle. You have to identify the patterns. So
Okay,
you have to identify the chronology. You have to identify the etiology. What is the etiology? Where did this start? How did this travel? What is the pathology?
okay,
Okay, what is the disease patterns by symptoms? So you can check their pathology report also by reference. No need if you are expert in the diagnosis pathology reports. No need. but
Okay.
but you can take reference from with the pathology report.
Okay, sir.
Uh, okay,
Okay, sir. Thank you, sir.
okay. Nandita ji, you are here and not asking you any question. Nandita Mathur, unmute yourself. Nandita
Yes,
Mathur,
sir. Good evening. Yes, sir. Good evening, sir.
good evening. How are
Yes,
you? After
I'm
long
doing
days,
good.
after long days, you are in my session.
Yes, sir. I was not well, so I could not join earlier. But now I'm okay. So, yes, sir. After a long time, I've joined this and really enjoying this. So,
Yeah.
these patterns with 60 shoe points, I really wanted to do it. So,
Hmm.
thank you for taking the classes, sir.
So, Nandita ji, send me your all the pathological report and tongue picture.
Okay.
Let us
Okay.
let us identify your patterns.
I'll do that, sir.
Are you used to acupuncture yourself?
No, sir, because not at that time. But I'm not doing puncturing. I'm doing just magnets.
Okay, let us. Otherwise, I will
I will
provide
talk to you,
you.
sir.
I will provide you the sound frequency by each acupuncture point. That work better.
Sure.
Okay.
Okay, okay. Yes, sir. Yes, sir. Yes, sir.
Sound frequency. No need to prick the needle. No need to apply the magnet. You have to hear that sound frequency
Oh,
uh,
sure.
of the. Okay.
Yes, sir.
Haribol. Ha.
Thank you, sir.
Okay. Welcome. हाँ शोभा जी, शोभा ठाकुर.
Sir,
शोभा
good
ठाकुर.
evening, sir. Good evening,
हाँ
sir.
गुरु. आपका
Sir,
वीडियो चालू करो ना. वीडियो चालू
uh,
करो शोभा जी. हाँ.
chalo hai, sir. Sir, good evening.
हाँ.
Sir, I have this kidney stone. Last week I had pain, see, kidney stone.
Yeah.
The doctor said it is 3 mm only. It will go by tablets. They have given tablet.
Yeah.
Yeah, I am
You
taking,
you
but
you done sonography,
sonography, no. CT scan they took.
CT scan they took.
Yes.
Okay. So
Mm.
send me reports of the CT scan and send me
Okay.
your tongue picture.
Okay,
Okay.
sir. Yes.
Let us take the consultation. Okay.
Okay, sir. Okay. Thank
हाँ
you, sir.
हाँ हाँ. Okay. Hmm. You join my group?
Yes, sir.
Okay.
Yes, sir. Long
Hmm.
back only I joined.
Okay. हाँ मंगल चिले बोलिए.
हाँ नमस्ते सर.
नमस्ते.
सर तुम्ही टंग डायग्नोसिस घेतलाय का क्लास?
ना आता घेणार आहे.
हा तेच ना, टंग डायग्नोसिस घ्या ना जरा, ते शिकायचंय सर.
घेणार आहे. आता मी डिझाईन करतोय. या
अच्छा.
कदाचित डिसेंबर किंवा जानेवारी मध्ये होणार.
होणार ना? हा
हा
तेच ना, कारण टंग डायग्नोसिस जरा बरं पडतं ना. थोडं.
हा. हो
हम्म.
टंग डायग्नोसिस केलंच पाहिजे. प्रत्येक ॲक्युपंक्चरिस्टला टंग डायग्नोसिस शिकलंच पाहिजे.
मस्त आहे
So
ना, हा मस्त आहे ना.
every acupuncturist should learn the tongue diagnosis.
हा चालेल, तुम्ही चालू करा सर, चांगलं आहे.
Okay. Okay.
ओके.
Okay.
थँक्यू सर.
Welcome. Yes. Hello. Anyone curious? Anyone have queries?
हॅलो सर डॉक्टर
Manjari.
मंजरी हा सर तुम्ही जे स्टमक पॉइंटचं जे सांगितलं
Manjari speak in English.
या येस
Many
येस येस
international
येस
public is here.
Yes, yes, yes. So that stomach 44 point. So you have said that it is for mania diseases. So if the
Yeah,
patient is not violent, but
yeah.
patient is having depression and means the thoughts are depressing, but not violent, then in
Okay,
that case, can
depression,
we just
depression,
needle it?
depression is the energy of the spleen.
Huh,
There is
huh,
spleen
huh,
depression. That is the
huh.
excess thought, depression. Uh, Okay, so
Hmm,
ST, it is when it is the young depression, use the ST channel. When it is the
hmm.
in depression, use the spleen channel.
Okay, along with that, if the patient is having some stomach problem, means
So
regurgitation
you
and
no, you listen, Manjari ji. Yeah,
huh.
you don't treat patient with their symptoms. Okay, you treat the person, not the symptoms.
Hmm, hmm,
Don't focus on the symptoms. So
hmm,
you see the symptoms by for your reference, but
hmm,
you should focus on his tongue. Its
hmm,
pattern. Okay,
hmm, hmm,
patterns, how he walk, how he talk, what he like, what he dislike. Okay,
hmm, hmm, hmm,
what taste he's expressing. Some sweet taste, that is a bitter taste. Okay,
hmm,
how
hmm,
he talking? He is talking loudly. He is talking like singing. Okay, he is
hmm,
talking
hmm, hmm.
laughing. Okay, he is talking
Okay, he is a bit
cheerful.
the anxiety element is there. Anxiety about his health.
Ha. Anxiety about anxiety means yeah, maybe it is the Shane disturbance.
Okay.
Shane reside in the heart.
Hmm.
Shane
Okay.
Shane reside in the heart. Okay,
Huh.
so there may be heart deficiency. There will be heart chi deficiency. There will be heart blood deficiency. But
Okay.
you should focus on the mother also. Who is the mother of the heart? Liver.
Yeah, wood. Huh.
If the liver blood deficiency, so definitely heart blood deficiency will be there.
Huh. Huh. Okay.
Okay, so
Hmm. Hmm. Hmm.
after before that you have to focus on the kidney also. If there is a kidney indeficiency,
Hmm. Hmm. Hmm.
there will
Hmm.
be liver indeficiency.
Okay. Okay.
So every organs, every elements are connected to the each other.
Hmm. Okay.
Huh.
Okay. Thank you. Thank you, sir.
Okay.
Okay. Thank you.
Welcome. Manjari, you have to learn too much yet.
Hmm.
Okay. Okay, thank you very much. So
Thank you,
still,
sir.
still anyone
Thank you, sir.
queries? Shobha ji.
No, thank you, sir, I said.
Okay, thank you. Okay.
Thank you, sir.
Thank you. So, okay, enough for
Thank you,
today.
sir.
Thank you, sir.
Thank you. Okay. Okay, now write on the group how session you like, how you got the knowledge. So is it useful for you? Okay, just talk on the group, write on the group. Okay, thank you very much. Ending the
Okay,
session.
sir. Thank you, sir.
Thank you, sir.
Okay, okay.